1, 2. 1, 2.
Thank you. Our chief guest, permanent principal secretary, State Department for Medical Services, Director General, chief guest, Health, permanent principal secretary, all invited guests, all protocols observed. Director General, good morning. Health. Good morning once again. All invited guests. We are now set our chief guest to start our today function. Apologies for starting a bit late. Good morning once again. This was due to some technical hitches, but now we are set. We want to start by presenting ourselves before God. Apologies for starting a bit late. And I'll call upon Hannah Getumbo to open this session for us with a word of prayers. We want to start by presenting ourselves before God.
Good morning. Yes, I'm not Hannah, but I will lead us in a word of prayer. And thank you for being here. Let's present ourselves to the Lord in prayer. We are thankful for another day that we have seen. We thank you for good health and for strength, for the milestones we have taken to reach the point that we have reached now. And Lord, we want to bless you and honor you today. We commit the program ahead of us into your hands. We pray that everything will flow smoothly. We pray that as we launch this National Cancer Control Strategy for the next 5 years, that we will, that you will enable us to implement all the interventions therein that will bring a change and positive change to the lives and the livelihoods of our fellow Kenyans. We bless you and we honor you, for it is in Jesus' name we have prayed and believed. Amen.
Thank you very much, Dr. Ball, for presenting us before our able Lord. We are grateful that he has blessed us with this very beautiful day. Thank you very much. And after the prayers, we would also want to honor our country by playing the national anthem. And our chief guests and all other invited guests, I'll kindly request all of us to be upstanding for the national anthem. The national anthem, please. And our chief guests. guests, the Principal Secretary, thank you very much, State Department for Medical Services, Ministry of Health, Hari Kimutai, our chief guest. Today we are pleased to have your presence as you lead us in today's very important function in the space of cancer, today where we shall be launching the National Cancer Control Strategy 2022 to 2027. Karibu DG, where we shall be launching the National Cancer. Our chief guest would want to recognize all those who are with us today on behalf of the ministry and on your behalf. Allow me to mention very quickly some of our guests who are with us. But before, Karibu Sana DG, before I proceed, let me mention that this function started yesterday at Serena Hotel, where various issues pertaining cancer were discussed by various stakeholders. We had a whole day and we had a very fruitful deliberations. Within us, we had representatives from UN agencies. We had a being led by WHO. Within us, we also had representatives from the civil societies being led by NCD Alliance Kenya. We also had the representation from Council of Governors, and we had the counties represented by the CECM, and the county directors of health. Council of Governors. We also had representatives represented by the CECM and the county directors of health. Council of Governors. We also had representatives represented by the CECM and the county directors of health. Council of Governors. We also had representatives represented by the CECM and the county directors of health. Council of Governors. We also had representatives represented by through your permission, we shall have some very brief remarks from our partners who have helped us develop the document which you shall be launching today. And the main documents which we shall be launching today is the National Cancer Control Strategy. Developed the document 27 shall be launching. We shall also be launching the monitoring and evaluation framework for the same strategy. I think this is a very unique way of doing things, because as we launch the strategy, we shall also launch the framework to monitor how well we are implementing the strategy. Similarly, sir, we shall also be launching the active protocol, whereby it mainly entails on how we intend to expand activities for cancer patients in this country. As you've been informed, more than about 60% of our patients with cancer. Activities for cancer patients in this country. As you've been informed, more than about 60% of our patients with cancer activities for cancer patients in this country. As you've been informed, more than about 60% of our patients with cancer. All the other civil societies who have been involved in this endeavor will give very brief remarks. You've been informed more than about 60% of our patients with cancer. All the other civil societies who have been involved in this endeavor will give very brief remarks. You've been informed more than about 60% of our patients with cancer. All the other civil societies.
Yoma, I cannot pronounce your second name. County government representatives, COGs. There are so many of those county things that I get confused, but all of you are remembered. And development partners, and most importantly, cancer survivors and their families. And also, ladies and gentlemen, distinguished guests, all protocol observed. I'm here to represent the civil societies in this country. Most important, I chair the NCD Alliance of Kenya, but we have many civil societies working in the space of cancer together with our government to reduce the burden of cancer in this country. So I wish to sincerely congratulate our Ministry of Health on this very important occasion, the launch of the 2023-2027 cancer strategy. I was lucky to be able to be part of the team that worked on this strategy, so I think we've done a very good job, and I look forward to us implementing what is written in this strategy together as partners. Again, the other document that Dr. Maria has talked about that are being launched, and I want to congratulate the Department of the NCCP team, the NCI team, Federation of Non-Communicable Diseases, and the other document. We are all aware that cancer is a killer disease, and we know that about 10 million people die globally of cancer. Of these 10 million people, most of them are in countries like ours, Kenya. We are all aware, and for many years, worked as a doctor for many years, in palliative care mostly, so I've worked a lot with cancer. Of these 10 million people, most of them are, and I know the burden of cancer is terrible. And for many cancer was actually a death sentence for many years in this country, until about 10 years ago, when we started prioritizing NCDs, when we had, and I think the ministry now had a division for NCDs and also a department for cancer. So actually, I want to just say that when we started prioritizing NCDs, when we had, and I think the ministry
many efforts that the government has actually put in place. One of them being that NHIF can actually now pays for most of the cancer treatment. I think about 75%, if not 100%. But also the fact that the government has put so many efforts. I know Dr. Maria, Dr. Leonyangasi, and their team have worked to actually bring up new cancer centers in the country. I visited Nakuru 2 weeks ago, and I was very impressed with the radiotherapy department in Nakuru and the cancer center as well. So I really want to say thank you very much to the team that has worked so hard to ensure that people are receiving, actually have access to cancer treatment. But this is not just the only thing that we need to do. We need also to focus on early screening, diagnosis, and also just talking to our public and people on lifestyles and what they can do to avoid getting cancer and other NCDs. So now we have quite a number of things that have been developed in the country. We have the National Cancer Control, we have the Kenya Cancer Control Act, we have the cancer policy, we have the Kenya Palliative Care Policy, the National NCD Strategy, the USC policy, and the cervical cancer screening guidelines, and also guidelines for starting a cancer treatment center. And again, of course, we also have the HPV vaccine. I think these are very good developments in our country. We are heading towards maybe making this country a cancer-free country. So many cancers we know are preventable if you focus on reducing risk factors, use available vaccines and screening. And early detection and diagnosis allows for effective treatment that leads to cure or prolonging life. Cancer pain can be eased, and I really want to recognize the Ministry of Health again for the project I worked with them on when I was still working before I retired, on making sure that we have access to opioids in this country. Our government is now providing oral morphine powder, the powder that we use for oral morphine, but is used for moderate to severe cancer pain. Most cancer patients will go through a lot of pain, severe pain. Most people will tell you that there's no pain, there's cancer pain. pain, apart from labor pain. And I'm glad the government has put efforts in ensuring that they have access to opioids for those people who need opioids, and also supporting palliative care units in the public hospitals and also the hospices. So I want to also continue acknowledging the work done by the Department of Non-Communicable Diseases, NCCP, NCI, to support the establishment of these cancer centers in the country, thus bringing services closer to the people, and also not forgetting the support that NHIF has given for these patients to reduce the deaths from cancer in this country. We know that a cancer control program is only effective and successful when it ensures that everyone in the community, county, country lives a healthy lifestyle, is given the best possible chances to prevent cancer and access to affordable, effective treatment as well. And again, not just treatment that ends with treatment, but also supportive care, survivorship, palliative care. Those are also part of a cancer control, of a cancer treatment services. And we as civil societies have a big role to play in all this. We're not just going to stand at the edge and look at what the government is doing, but we are going to be part of this strategy implementation to work together with the government to ensure that we are easing the burden of cancer. So I wish to thank all civil societies, particularly the Kenya Network of Cancer Organizations and its members. They do a lot of work in terms of awareness, screening. I wish to thank the patient-led organizations, particularly the cancer survivors and the various support groups. For cancer support group, these are initiatives of people who have had a diagnosis of cancer or have lost a loved one of cancer. So as Kenyan community, we're not just standing and waiting for the government to take the lead. We are also doing something as community members. We're trying to see what we can do to improve our lives. These people take their time to do advocacy, to create awareness, to screen, and even to navigate patients through the system. They also at times contribute financially to those unable to pay for their investigations, treatment, transport, or accommodation. They form support groups and enhance community resources to support those affected. They work hand in hand with those affected. So civil societies, patient-led organizations, support groups really play a key role in cancer issues in this country. They are indeed very valuable to ensuring that these strategies succeed. So we are actually very excited about this strategy, and we do not want to be left behind. We want to be part of it. The fight against cancer is our business, it's your business, everyone's business, and we must all unite to win this fight. So thank you very much, and congratulations to our government for this wonderful day and this wonderful launch of this document. Asanteni sana. And we must all unite to win this fight. So
Thank you very much, Dr. Zipporah, Chairperson NCD DAC. We now want to take this opportunity to invite the representative of development partners, and we'll only have one speak on behalf of all of them, but we also want to recognize the presence of BD who have walked us through this journey, particularly when it comes to the printing of the document. We also want to recognize all those other partners who worked with us when developing this document, and to represent all those, we have Gerard Macharia, who is the director charge Kenya, to speak on their behalf. Karibu director. Asante. Makofi kwake kidogo. Asante sana. And as you prepare, the owner of the vehicle KBV 073E Prado, kindly remove it from where we have parked. You are blocking something. And as you prepare, the owner.
Thank you very much, Dr. Murray, Principal Secretary, Harry Kimtai, DJ Patrick Amoth, WR Representative Roma, Dr. Murray, government officials here, including NCCP, DJ and NCI, development partners, fellow guests, ladies and gentlemen, good morning. I think we're still in the morning. The development partners, my remarks are actually very few, because I'm speaking on behalf of all the partners that have worked with the National Cancer Control Program and the Ministry over a number of years since we began this journey back, I believe, in 2017, 2018. and the progress that has been made, and coming to this point of launching a second strategy that takes us to 2027, and also launching our monitoring, evaluation and learning framework. The documents are good things to have. The documents are as good as our ability to take what is in those documents and make practical implementation out of them. And the challenge we've seen over the years, and even in the previous strategy, is how we translate some of these policies and documents into actual practice on the ground. And I'm glad the COG and I think a couple of CECs from the counties are here, because those are the folks who own the infrastructure that we use to implement some of these things. And the progress they have made in the practical implementation of some of these things that we write up is as commendable as the work that has been done by National Cancer Control Program and the Ministry, and we commend them for that. I don't know whether I'm allowed to ask us to clap for them. Maybe we should applaud the counties and the work that they keep doing in translating these documents in practicality. And I can tell you from experience that it's not just the infrastructure that we're laying out there, or the bunkers that we're putting together for radiotherapy, or the chemotherapy centers that we're putting together. It is our ability to make those ones work for our population. That is what counts at the end of the day. It is not how good this document is and how well written it is. It is whether we are saving people's lives out there by making very good practical use of the infrastructure that we are laying out. Infrastructure is easy to put together and to cut tips and to show that it is there, it exists. The question is, how many lives is that infrastructure actually saving? And the biggest challenge is there. And if I look at what is ahead of us, where the loop has been completed is in the secondary prevention of cervical cancer. Because not only do we have everything that we need, documentation-wise, guideline-wise, but we also have equipment that has gone as far down as level 2 facilities that can take care of precancerous lesions that we pick up during the screening of cervical cancer. It is as practical as that. If that loop is completed, we're getting close to being able to say we can eliminate cervical cancer and we can manage all the other cancers comfortably. Not even mentioning the prevention work that needs to be done. And I hope someone does mention at some point that as far as cervical cancer is concerned, the HPV vaccine is down to 1 dose now. There's no reason why we shouldn't immunize all our 10-year-old girls with that 1 dose. They don't need to come back again for a second dose. 1 dose is now enough. So that prevention approach works probably even better than all the infrastructure that we are laying to come and treat the disease when it has already advanced. And again, coming back to all the chemotherapy centers that we're setting up, the question is, and we are again going back to our counterfolks, whether we have the personnel that we need to run those chemotherapy centers. Do we have the oncology nurses? Do we have oncopharmacists there who can mix those molecules? Do we have proper follow-up care? How extensive is our palliative care system, in the country for those people who are already getting on to that kind of treatment? So those are questions that you probably don't answer in these documents, but those are the questions, Madam Waziri, you grapple with on an everyday basis. Patients are here, are the molecules here? Is a person mixing them here? Do they have the necessary equipment to mix the hoods that they need to mix those drugs? Is the administration apt? Those are questions that unfortunately we end up leaving to you. And what I'd urge for us to do is to complete the loop, including our capacity for oncopathology, and I know we don't have many of those in country. 5 years later, coming to do another launch, it is going to ask Madam Waziri here, 6 months down the road, how are you doing? Are we using the infrastructure that is there? What else do you need so that we can help you make a better job of these documents? That's the only real reason why we should be doing this launch and none other. So let's complete that loop. Let's go down to where the action happens and where our patients are showing up. They don't know these documents exist. All they do is they come up there and listen to the person who they see first. Let's do what needs to be done by completing that loop. Asante sana, thank you very much.
Asante, makofi tena. Thank you very much, Gerard. It is now my pleasure also to invite the acting CEO, National Cancer Institute Kenya, his representative, Dr. Mwangi, to give brief remarks on behalf of the CEO. Karibu, Dr. Mwangi. Makofi kwa Dr. Mwangi.
Thank you very much. Our Principal Secretary, Hilary Kimtai, our Director General, Dr. Moth, our WHO county representatives, our development partners, our CCMs and county government officials, civil society, our NCD stakeholders, members of the media, our invited guests, all protocols observed. Ladies and gentlemen, good morning. For us as an institute, it's an honor to join you all here on this monumental day. We are most sincerely thankful to the leadership of the Ministry of Health, led by our Cabinet Secretary, for the support that has been accorded in the process of development of this third National Cancer Control Strategy 2023-2027. We are also very thankful for the support that has also been provided to the Institute in steering the cancer prevention and control in this country. As an institute, we deliver our mandate as provided by the Cancer Prevention and Control Act 2012, which spans across all the pillars within this strategy. And we are very happy that the journey has brought us here. It has been an inclusive and also an exhaustive journey. At NCI, we continue to bring on board all actors in a collaborative manner to ensure that we deliver on reducing the burden of cancer in Kenya. So as we deliver this burden across the continuum of care, prevention measures that have been mentioned here, from vaccination to public awareness within the community, mainstreaming of cancer across the different ministries, government agencies, and even organizations, increasing screening and ensuring that those who are diagnosed with cancer are receiving quality treatment in safe environments within the Republic of Kenya. We also recognize that our health is a devolved function, and we are also working as an institute to make sure that we engage the county governments so that we are able to prioritize cancer within the county governments through the departments of health in the county governments, through engagements with the county assemblies, and also assisting the county governments come up with county cancer action plans that will improve the response to cancer. The Institute has also established a national cancer registry that clearly demonstrates the burden of cancer across the counties, and this is supposed to help support the counties have evidence-based planning and decision-making while we look at ways and innovations of responding to the burden of cancer. As an institute, we commit to work with all stakeholders to deliver the goals in this strategy. We also endeavor to continue learning through research and steering the cancer response discourse, and look to all of us, each one of us, in having continued support to strengthen the cancer prevention and control response, and ensure that we implement, monitor, and evaluate the work that will come out of this strategy. I want to thank you and congratulations. Thank you very much.
Thank you very much, Dr. Mwangi, for very ably representing the CEO, NCI Kenya. Our chief guests, the next remarks are to be from Professor Nicholas Mbinya, who led the process of developing the NCCS, but I'm told he was not able to join us today. Kindly accept his apologies. And having said that, I now want to invite the representative of COGs, and that will be the CECM Nandi County. The CECM Nandi County, we also kindly request you to introduce the other CECs who are with us today, so that we would want them to feel very, very much recognized and appreciated. Asante sana. Tumkaribisha na makofi. Thank you.
You just want them to stand?
Yeah, just to stand.
Okay. Our Principal Secretary of Medical Services, Mr. Harry Kimutai, our Director General, Dr. Amoth, the CEO, National Cancer Institute, the Chief Executive Operations representing government partners, the WHO County Representative, representation from the civil society, representation from the development partners, my fellow colleagues, distinguished guests, ladies and gentlemen, good morning. Allow me to have my fellow colleagues, the CECMs in charge of health from the counties, to stand up. The team here today is the team that is committed to ensure that whatever is in the strategic plan will be well implemented in the counties, and the communities and survivor involvement will be there. There'll be social justice, the UHC agenda, the patient-centered care, the evidence-based interventions, equity and inclusivity that is in the strategic plan. Thank you so much. You may sit. Allow me, I don't have a written speech, but allow me to first say that this is a very important day for the country, Kenya. All stakeholders have been involved during the preparation of this strategic plan, and we all know that all of us sitting here today has been, one way or another, been affected by cancer. And I like to always say that cancer is in every village, cancer is in every community. Your workmates, your churchmates, everyone has been affected by cancer. And what came out clearly from all the stakeholders was we have never made enough noise about cancer. And globally, about 10 million deaths happen with cancer. Cancer is a global problem. And if you look at the cancer cases that have happened globally, no one has made the noise that it so deserves like we did with COVID. I say so because from the 10 million deaths that we have, it means a plane crashes almost every day, not just one, but many. 52,000 737 Boeing flights crash yearly. I don't know if all of you are listening to that, which means in Kenya alone, 174 flights crash, and whenever there is a plane crash, it will be on CNN, it will be on Fox News, it will be on Al Jazeera, it will be on NTV, it will be on Citizen. every 15 minutes. But the magnitude of the patients we lose to cancer is immense, all recognized by all the stakeholders here today. Denmark, Belgium, Australia, and those first world countries leading with over 300 patients, over 1,000 dying to cancer in their populations. In Kenya, we are half, but the lowest globally is Niger, Nepal, Congo, our neighbors, South Sudan and Sudan. And being a global problem, sometimes we are looking for solutions elsewhere. We should go to our neighboring country and find out what disparities, what is happening there. Likewise, look at what is happening globally in areas where they have high numbers. We have all said that we must take research seriously and see what is happening in those areas so we are not affected. Cholera took 31 years to go from South Asia to the Americas and 10 years to get to Africa. COVID took less than 3 months, and it was a global experience for everybody. Whatever happens in those countries with high incidences can happen here in Kenya too. So it is important we look at it as a global problem. We need to be futuristic and look for sustainable measures. As counties, we are committed to ensure that we provide the preventative services, the early diagnosis, the wellness that has not been embraced very well, the holistic care from prevention to end-of-life care. There is still inequity across the country on cancer services, and as we all know, radiation that has been mentioned is only provided in very few institutions. KNH, Nakuru, MTRH, and sometimes we have our patients going by to the neighboring Uganda. So part of the strategic plan is to ensure equity in access, as time is very essential in ensuring the survival of our patients. The HPV vaccines has been implemented in counties, and I know many counties have partnered with KEMRI on the HPV testing, showing more than 20% of those tested randomly being positive and giving a chance for those under the age of 30 to receive the vaccine that is life-saving. We've also mentioned the investments that counties have done on HRH. It is also very important to look at our gaps in areas that support cancer, like radiology, oncology, pathology, and reconstructive surgery. Most also important is the pediatric population. The pediatric population, the goal is to ensure their survival is more than 60%. Globally, pediatric oncology patients have a 90% survival. Our long-term goal is to go for what is there out there globally. Our pediatric patients so deserve the care that they need, and we have to invest in the HRH training, not only for the general population, but the pediatric patients. On the disease registries that we have, it is also a time that we partnered with many institutions locally and globally to ensure that we can geo-map and see where these patients are coming from. The solutions may be within our communities. We must work with the communities and see in the high prevalent areas, what can we do for prevention to ensure that we don't lose more people to cancer. One of the successes we've also had in counties, we have a handful of oncologists, but many counties have used telemedicine to ensure that no care is delayed, whether in imaging or consultation on the drug regimens to give. As counties also, we are committed to ensure that the commodities that are needed for diagnosing and treating our patients are provided timely, as well as to make services available such as imaging, mammography machines are available, but the use is not what it should be. So sometimes it's not a matter of the availability of the equipment. It is a matter of the citizenship involvement on using the imaging machines, as we all know that if caught early, we can do early interventions. So more advocacy needs to be done to reach out to reduce the inequities. We need to also to invest a lot on health literacy, not only on the caregivers, on the populations, but also on the family members who take care of their loved ones to ensure that the treatment is done well. And also for the common population to access the free screenings to prevent cancer. On policy reforms, NHIF has done a lot of reforms. The continued reforms will ensure that the inequity of cancer care is covered, such as no delay of treatment for patients suffering with cancer, and also ensuring they get the entire full regime that improves their survival. In the cancer reforms, we would also like to ensure that we all work together to make cancer care affordable. If you go to India, the amount of money used to treat prostate cancer, it costs us in Kenya what you would use to treat 5 patients. So part of the problems that we have is making healthcare affordable by making commodities also affordable. Synergy from all levels, from all sectors, the private, county governments, Ministry of Health, the private sector, communities, all stakeholders, the academia, will ensure that cancer care in Kenya will be equitable. Calling upon the private insurance, it is also time for them to make reforms where they cover for early diagnosis and prevention to cover cancer care, not just the curative care. So it's all our responsibilities to go and make the noise, and for the resource available that causes the inequities of care in cancer. It is time we took a global perspective as a country to ensure that healthcare is funded. As a country, we are still at the 11% of the Abuja Declaration. Counties are investing more than 30% of their budgetary allocations, but it is very clear with the many success phases that have happened in counties, counties still remain underfunded compared to the pre-devolution era. So as a country, we must care. There is no such thing as a free lunch. And with a good social health insurance, no one will be denied access to health care in Kenya. We need to value how we finance health insurance so that we achieve UHC with minimal burdens that we see cancer creates so much poverty across our populations. As Kenya becomes a mid-income economy and the partners are slowly moving out, we must also look at the internal resource mobilization as well as make it a multi-sectoral agenda to run health matters, like agriculture running food safety measures to ensure that we have safe food and less cancer. Running nutritional programs that ensures we have a healthy population. We must also include education environment, as well as public works and the manufacturing industry, as we value data and issues that may be causing cancer in our community. We must all work together and take the other sectors as partners to run the health agenda so we can have more funding for other issues. We must not forget that as counties, we are committed to providing proper cancer centers, that our staff are safe, our patients are safe, and their cancer and their caregivers are safe by having good IPC standards and proper waste management in cancer care. We must also ensure that alternative medicines in our communities do not set us back. So in this agenda, we covered being patient-centered, community-centered, by ensuring that the practices in our communities don't delay care or don't have myths that will affect our patient care. We still have an opportunity in palliative care, and during COVID-19, where we did home-based care, many counties have taken the opportunity to expand services for home-based care for our cancer patients. Pain management being one of the issues, as well as the mental health support that the patients and the caregivers so much need. Thank you so much. May God bless you. And as county governments, we are committed to ensure that the good documents that we make, the good policies that are made, are implemented well in the counties. Thank you.
Thank you very much, the representative of Council of Governors. We are happy and proud to be associated with you. And we also are very happy by the support you are giving us, particularly by that is evident from the large members of CECM who have joined you today. So we are very, very proud of that. Now it is the time for WHO country representative, Abdurrahman Diallo, to give his remarks. And for today, he is represented by the very able Dr. Ihioma. Hope I've gotten the pronunciation today. Karibu, Dr. Ihioma.
Thank you very much, Dr. Mare. The Principal Secretary, Harry Kimtai, please forgive me if I don't pronounce the names correctly. DG Patrick Amoth, Dr. Wangi, representing the CEO for NCI, Dr. Zipporah Ali, Chair of the NCD Alliance, the CEC CM for Nandi and other CEC CMs here present, the NCCP team of the Ministry of Health, Dr. Gerald Macharia of CHAI, and other development partners here present, all other protocols observed. My name is Ihioma Onwekusi. I tend to pronounce my name very slowly. I am not the WHO representative. I am here to present the remarks of Dr. Diallo, the WHO representative, who is unable to attend this event and has sent his apologies. So permit me to read his remarks on his behalf. It's a great pleasure to be with you this morning as the country launches the National Cancer Control Strategy 2023 to 2027 and other related documents. A big congratulations to the Ministry of Health and partners for this great achievement. Cancer is a leading cause of death worldwide, as already mentioned, accounting for nearly 10 million deaths in 2020. Around 1/3 of deaths are due to lifestyle activities, including tobacco use, alcohol consumption, lack of physical activity, low fruit and vegetable intake. The cancer-causing infections such as human papillomavirus and hepatitis are responsible for approximately 30% of cancer cases in low and lower middle income countries. All these are preventable causes that we can bring to a halt if we all join hands together. Many health systems in low and middle income countries are least prepared to manage this burden, as large numbers of cancer patients do not have access to timely quality diagnosis and treatment. Many cancers can be cured if detected early and treated effectively. WHO continues to support member states to promote national cancer control policies, plans, and programs that are harmonized with strategies for non-communicable diseases and other health-related concerns. As a technical agency, we set norms and standards for cancer control, including the development of evidence-based prevention, early diagnosis, screening, treatment, and palliative and survivorship care programs, as well as to promote monitoring and evaluation through cancer registries and research that are tailored to the local disease burden and available resources. To strengthen national efforts to address the burden of cancer and other NCDs, the WHO Global Action Plan for the Prevention of Control of NCDs 2013 to 2020 provides a roadmap to reduce premature mortality from NCDs by 2025 through targeting many of the risk factors to major NCDs, including cancer. In 2017, WHO launched the Guide to Cancer Early Diagnosis, which aims to help policymakers and program managers facilitate timely diagnosis and improve access to cancer treatment for all. By developing effective strategies to identify cancer early, lives can be saved, and the personal, societal, and economic costs of cancer care are reduced. In 2020, the World Health Assembly adopted the global strategy to accelerate the elimination of cervical cancer as a public health problem, while in 2021, WHO developed new guidelines for screening and treatment of cervical pre-cancer lesions for cervical cancer prevention. In the same year, WHO launched new tools to help countries build effective childhood cancer programs and established the Global Breast Cancer Initiative. Together, we can promote healthy lifestyles, prevent cancer, put measures in place for early detection, effectively treat and cure cancer, and provide quality life through palliative care. As WHO, we will continue providing the necessary support towards prevention and control of cancer in the country of Kenya through the effective implementation of this new cancer control strategy. I thank you for your attention.
Let's give Dr. Hioma another round of applause. Thank you very much. Before I call our DG Health, I want to take this opportunity to just request, through the permission of our chief guest, the representative of FIND and BD, just to stand and wave to the crowd and the chief guest. Well, we have the two organizations have really been instrumental to development of this document, sir, and we really do not take that for granted, and we are very, very much appreciative. Likewise, we had one Elizabeth Mora who was supposed to do a poem, but because of time, we could not have the poem. Maybe you can stand so that she's as tall as me. Karibia hapa uonekana na chief guest, then you wave and sit down.
Amjambo. Msichana mrefu lakini shairi sauti akanyoka pangoni. Kuna mstari mbili ya kutoa ya kansa.
Pengine upatiwe dashi. Okay. Asante. Thank you.
Haya shimgambo inalia, abadani sijifichi, mambo yametulemea, kuwauliza misiwachi, mwenye jibu na ngojea, tutoe ugonjwa wa kansa ili tuwe na neema. Waziri wetu Susan kasema, kila mtu kasikia, kansa si ugonjwa mzuri, yamaliza wanadamu. Nukta tukilala hospitalini, hatuna pa kwenda. Hongera Waziri Susan kwa yote uliyoyasema. Asanteni.
Thank you very much. I think that sets the stage very well for our DG. And it is now my pleasure to welcome the DG to give his remarks. And also, after that, he can invite our chief guest to address us. Thank you very much. Karibu DG.
Thank you, Ephantus. Harry Kimtai, CEC members of Health present, and thank you for coming out in your tents. The WHO representative, I will not mention the name, the representative of the CEO of National Cancer Institute, the representative of the chair of the NCD Alliance, Gerald Macharia representing the development partners, colleagues from the Ministry of Health, civil society organizations present here, the academia, members of the Fourth Estate, distinguished guests, ladies and gentlemen, dear friends, good morning. I also want to take this opportunity to join all of us as we launch these 3 strategic documents. We know the burden of cancer in this country is huge, like in the global arena, and the ministry continues to prioritize cancer amongst the other NCDs, including the metabolic disorders like diabetes mellitus and cardiovascular diseases, which form the largest bulk of the NCDs, not forgetting the rising burden of mental health. And cancer is a priority for us because of 3 reasons. 1, the number of cancer cases in this country is on an upward trajectory. Actually, it is estimated that by 2040, the total number of cases in this country will double. Number 2, is the expense you incur when you are diagnosed with cancer. It is the leading cause of catastrophic health expenditure. And catastrophic health expenditure actually leads into poverty, because when you have a family member diagnosed with cancer, family members will be able to do everything within their means. They'll be able to sell all their properties to ensure that the family member gets treatment. And in that process, they get into abject poverty, therefore affecting the entire household. As a country, we estimate that if you are diagnosed with cancer, and unfortunately most of our cancer cases are diagnosed late, the total expenditure in treatment is more than 1 million Kenya shillings. If you multiply that by the estimated number of cancer cases, which is about 85,000, that comes to 85 billion Kenya shillings. Our total health expenditure is estimated at 300 billion. So one disease alone nearly takes a third of our total health expenditure. So that situation is untenable, and therefore the launch of this document is critical to be able to change that scenario. And what is fundamental in this document is now the shift from focus on curative cancer services to preventive and promotive along the primary healthcare approach in our journey towards universal health coverage. Why primary healthcare? Because primary healthcare tends to be integrated. It is holistic. It promotes equity. It promotes coverage and access. Therefore, services will be closer to the people. And when we are talking of prevention, in our own studies done here in Kenya, $1 invested in prevention gives a yield of $16. If that was a pyramid scheme, all of us will join in their droves. This document being launched here today has 5 critical pillars, including awareness creation, early diagnosis and screening, treatment along the continuum of care, and we believe through the primary healthcare approach we'll be able to strengthen our healthcare system to be able to respond to this rising burden. Number 3, cancer investments require a lot of resources, not only in the health ecosystem, but also in the non-health ecosystem, for us to be able to change this narrative. Therefore, as a ministry, we are going to prioritize integration of cancer care services, promoting prevention and health promotion.